So today we're going to be going over ECGs. Alright, so first thing I'm going to do is I'm going to check to see if there's a doctor's order, which I've been able to pull up right here. So we've indicated that we need to be taking that ECG right now, so let's go ahead and check on the patient and get some hand hygiene going. Alright, so let's get my hand hygiene going. Okay, let's I'm washing my hands as we go and check on the patient. Hey Carol, can I come in? All right, hey Carol, I'm Mitch with Respiratory. I'm just following up with the doctor's orders. We're gonna get you an ECG going just to check on that heart pain that you had earlier. So I'm gonna go ahead and attach some leads. All right, so let me just go ahead and confirm your name right here. Can you tell me what your birthday it is?
April 25th, 2000.
Okay. So have you ever had an ECG before?
No.
Well, no problem. It's not gonna hurt or anything. We're just gonna attach these electrodes onto your body, and then we're just gonna get a reading. It's not gonna shock you or anything, but it should give us a reading. That way we can give that reading to the doctor so he can better assess you, okay? Okay. So what I'm gonna wanna do is I'm gonna wanna find the sternal notch right here. I'll go down to find the sternal angle. From there I can find our second intercostal space just outside of that and go down to third, fourth, right here. And I found our fourth intercostal spaces. From there we can just place our first and second lead. So I'll go ahead and get that first and second right there. Now I have located my fifth intercostal space. From here, I'm going to want to go over till I find the mid-clavicular line. I'm going to put 4 right there, and then 3 in between 2 and 4. So you can see that we have 1, 2, 3, and 4. We're going to move over to the mid-axillary line, put 6, but then in between, we're going to have 5 on the same transverse plane as 4 right here. So as you can see, we have 5 and 6 set up, 1, 2, 3, 4, 5, 6. Now we're just gonna essentially attach our limb leads. We wanna place these on areas that have the least amount of muscle movement, just because we don't wanna have it interfere with the readings, but this will just give us different, essentially helps perfect our reading by having these electrodes placed. And then we're gonna come down to the legs. Like I mentioned, we want to place these in areas that have the least amount of movement possible from the muscles, but you can put them on the thighs too. You're gonna have the patient sitting and not moving at all when the test is being conducted. So here we're gonna have our 10 leads, essentially to get our reading. 6 on the chest and 4 on our limbs right here. Now we'll go ahead and pretend that this is going to be the monitor right here. We'll have each wire essentially have their own individual lead go to and connect with each spot, right? And they'll be designated we'll have lead 1, lead 2, lead 3, lead 4, and so they each would have their own individual wire coming out where we would then attach. And then, all right, once everything is placed, Carol, you ready to get your reading done?
Sure.
Perfect. We go ahead and activate. No movement from the patient as we get the reading, and that's it. As that is the end of the procedure, is there anything else that you need, Carol?
Can I get my tigers back?
And scene.